Hello, this is your coronavirus update for the state of California and the United States. As you can see, the cases are slowly dropping, the death rate's dropping. More people are getting affected, but it's not affecting people as much. You have 552,000 confirmed cases in California with 10,000 deaths. All the United States, you could say, is probably 5 million people and 162,000 deaths, which has dropped the death rate down real low. If you haven't subscribed to my channel, please subscribe and ring the bell for future updates, and please give this video a thumbs up. The coronavirus deaths up, hospitalization down in California amid case disaster. Yes, they're messing up on the cases. How many people got it, how many people don't. That just goes along normal with what's going on in California. This was published August 8th and updated August 8th. The California News Health latest headline news. Again, they messed up on the cases. Do not know how many people are really infected, but I'm sure it's 2 or 3 times more, some would say, than what the 500,000 is. California reported 186 deaths from COVID-19 on Friday, the 4th deadliest day on record. The same day, officials announced Governor Gavin's investigation order into the errors that led to the backlog of up to 300,000 lab records in the state coronavirus tracking system. The state entered Friday with a 7-day average of 145 daily deaths since July 29th. The state has reported the 4 deadliest days of the pandemic, including 215 deaths on July 31st and 197 deaths on August 4th. The 187 deaths Friday bring the total up to 10,210 COVID-19 fatalities. You got to remember, folks, California's an awfully big state. I think it's got over 20 million people here. So the percentage is down real low, the death rate toward how many citizens are in the state of California. California counties also reported 7,900 new cases out of the total 549,000 cases. Although problems with the state's reporting system mean these numbers are probably way off. The state crossed the 10,000 death toll on Thursday, likely making the virus the 7th leading cause of death in the state, ahead of diabetes, influenza, and a lot of other ones. It still has not surpassed how many people die of diarrhea every year in the United States. I know that sounds horrible. Any death is bad, but a lot of people don't think it's as bad as what they say. But like I said, any death is bad. People are just really scared because we don't know. Of pneumonia and hypertension, according to the 2018 mortality data from the U.S. Centers for Disease Control and Prevention. Again, I'm not knocking this. This virus is out there. We know it's out there. Not too many people know somebody that's been affected by it. Not too many people know of somebody that died from it, which is a good thing, which means it's not really spreading through everybody. But again, a lot of people think that most of the United States has already been affected, and this is what we got to deal with. But I always wonder why they don't require masks and everything if you got the flu or stuff like that, if they're going to make that mandatory all the time, or stay at home if the flu happens, because the flu kills just as many people a year, the regular flu. The Los Angeles County reported the most COVID-19 deaths, 49, followed by Riverside County with 29 deaths and San Joaquin County with 19 deaths. Fresno, Stanislaus, and Kern counties followed with the most new deaths as the virus has moved to the more rural parts of the state, where it has hit hard the state's largest agricultural workforce. Again, folks, I'm not saying that this virus isn't out there. It is. I just don't know if it's as severe, and a lot of people are saying it's not as severe as what they said, since it's fallen on an election year, that this might be dragged out, some people are saying. Residents make up 36.3% of California's 18 and older population, and 46% of death that age category. Black residents up 6.1% of the 18 years old. California, and 8.4% of deaths. Only 1 person under 18 has died of COVID-19 in the state, which is good. On Thursday, the state also reported a 2.8% decrease in the number of patients hospitalized with confirmed cases. Suspected cases of COVID-19 to 7,277 patients. There were also a 2.4% decline in the number of patients in intensive care units with confirmed or suspected cases of COVID-19 to 1,978. A lot of people have to get tested before they go back to work, so that's why it's showing the rising number of people that are infected compared to how many people actually took the test that weren't infected. I would like to see those numbers of how many people actually took tests that weren't infected, so we can know. You know, United States and everywhere, everything's about numbers. Everything. What's your percentage of a credit card? What's your mortgage rate? All this kind of stuff. Everything's about numbers. Even the license plate on your car is about numbers. But we're just not hearing the whole story. We'd like to someday find out, I'm sure after the elections, how many people really got infected by this. It's sad that anybody passes away. I think they should focus all the attention on our senior citizens to protect them. Alameda and Santa Clara counties both had 175 patients hospitalized with COVID-19, followed by 98 in Contra Costa County, 85 in San Francisco, and 45 in San Mateo County. Here's a little bit more statistics if you want to read it by yourself. This virus is mostly affecting people that are sick. A lot of people with lung cancer, heart disease that are dying, stuff like that. This COVID-19 comes in, which they don't need any more problems, and it just speeds up their death process. People with underlying medical conditions such as heart disease and diabetes were hospitalized 6 times as often as other healthy individuals infected with the coronavirus during the first 4 months of the pandemic. And they died 12 times as often, according to the Federal Health Agency reporting Monday. Got to protect our seniors. Need to put all the focus on the senior citizens to protect them. Let everybody else go back to work that don't have health problems, and then it's not going to bother. And just put all that effort into protecting them, and I think we could actually get this under control. Well, folks, if you haven't subscribed, please subscribe and ring the bell for future updates, and give this video a thumbs up, and thanks for watching.